Thank you, and it's a great pleasure to be introducing this session, Pathway Toward Drug Checking in Victoria. And we've got Dr. Monica Barratt, who's quite an identity around the sector these days. She's here, there and everywhere, and we really appreciate hearing from her. Monica Barratt, as you may know, is a drug researcher at RMIT University. She leads research at Blue Light Org, Global Drug Survey and the Loop Australia. She's studied digitally facilitated drug trading, cannabis cultivation and policies, drug checking or pill testing, and ways of increasing meaningful involvement of people who use drugs in research and policy process. She's also got a long list of expert witness presentations to her name, which is you know, it's really important to get people who have done thorough analysis of the area we work in to have the time to actually provide evidence base to some of these inquiries, and it's really valuable work. And Monica also contributes to data to the United Nations Office of Drug and Crimes World Drug Report. So a warm welcome to you, Monica. Over to you.
Thanks a lot, Sam, and thanks to everyone for having me here at the Service Providers Conference. I was really looking forward to the face-to-face version, but also very impressed with how you've put together this online version too. So, okay, so today I'm excited to talk about drug checking with you all, and in particular focus on the pathways towards drug checking in Victoria. If I can get my screen. Oh, here we go. I'd also like to acknowledge the Dja Dja Wurrung people, which are the traditional custodians of the land I work and live on here in Castlemaine. And this is an amazing tree that recently, the grandmother tree here in Dja Dja Wurrung country, which was recently crowdfunded for local people to buy this land. So this is a really exciting development here for Dja Dja Wurrung. And I'd like to extend and respect the Aboriginal and Torres Strait Islander peoples here with us today. So basically, I'm going to try and do this presentation in two major parts, just to talk a bit more about drug checking, the current evidence around it, and then look at the situation in Victoria, which is a little bit of a timeline, kind of leading up to pretty much now. And then finally, I wanted to just spend a couple of minutes on the Loop Australia. I'm also associated with the Loop Australia, just to introduce them for those of you that aren't familiar with that. And then hopefully there'll be a little bit of time for some questions at the end. So in terms of this primer on drug checking, what is it? What problems are we trying to address with it? How does it work? How is it done? And also what's been happening in Australia more broadly before we move to Victoria. So I wanted to start in 1967 because drug checking is not a new thing. And I love this quote. Street drug analysis, what it was called back then, became a valuable treatment tool during the Summer of Love in 1967, when thousands of young people flocked to San Francisco's Haight-Ashbury district and began turning on to a variety of unknown substances, including peace pills. So this excellent paper from 1985 called Analysis Anonymous. So 54 years and counting of drug checking, and with my research, and as Sam said, I've kind of been doing this for a while. I've really had the luxury of, I had a research fellowship for 5 years at the Drug Policy Modelling Program, which allowed me full time to really look into the history of this method and to sort of do this kind of work. And it was called a number of things, and some people will talk about pill testing in Australia, but really, yeah, got street drug analysis all the way through to point of care drug testing. And this is not just for MDMA or pills. I think it sort of started that way in Australia in the concept of pill testing, but really any drugs have been and can be analysed in this way, both for what's contained within that particular sample and also the purity or dose. So I loved this one from 1974. It's a book out of Canada, which has some excellent chapters, things like the evolution of counterculture street drug analysis programs, this kind of thing. So I guess my point here is this is not some kind of new fangled intervention. It's something that really has been around since Prohibition. I mean, I think it's worth noting that late 60s is essentially when we had the UN conventions make illegal the drugs that we're talking about, therefore creating these black markets, and therefore these opportunities for adulteration and misrepresentation became possible. So I guess at this point we need to define what it actually is to do drug checking. And so I've got some defining features that it has to have, and then some variable features that may vary between different drug checking providers. So in terms of the defining feature, we need to have a consumer, a drug taker, who submits a proportion of their drugs for testing, pills, powders, it can be other substances, and then a service that is capable of determining the chemical composition of that sample, and often also hopefully the dose and the purity. These test results then are provided back to that individual person, which can then help them decide, maybe how they're going to use those drugs or whether to use them at all in some cases. And the overall aim of a drug checking service is to improve public health and safety, to basically for harm reduction, not for, say, primarily law enforcement purposes, for example. And then the variable features, most drug checking services have a brief intervention. It's very unusual just to provide the results and that's it. So it's this opportunity to engage with someone who may not engage with AOD services typically, to have that brief intervention about their drug use and how the composition of the substance that they're considering taking might affect them. And most services also publicly disseminate their results in terms of public drug alerts. For anyone that was just in the breakout with Rita and Isabel, we're talking all about that there. So drug checking services can feed into those public alert systems too, and can provide much more rapid information about what drugs are out there. The wait time, so whether or not an individual needs to wait 5 minutes, an hour, and in some services they might even submit them to find out weeks later. So these are quite different and are going to suit different clients with different needs. Now, I think the debate in Australia is often focused on the idea of a testing service at a festival. This is obviously one way it can be done, but you can also have a drug checking service in a supervised injecting facility that certainly exists around the world, or in an outreach facility, or in its own fixed site, say in an urban setting, where the only thing there is the checking service, but it could then be integrated with other AOD services. So these are all possible, and certainly there are examples of them all around the world. The type of analytic testing conducted is a massive variable feature, all the way from, some services, at least historically, would simply use reagent tests, which can only tell you a very, limited amount of information, all the way through to a very sophisticated laboratory testing. And I'll put my hand up here saying I'm not a chemist, even though some of the things I'll talk to you about involve this. Yeah, hopefully I'll relay it in a way that is at least true to my colleagues with chemistry background. And of course, the type of analytic testing very much is dependent on the funding model. A lot of drug checking services around the world have been sort of community services that people have realised in the community that they need, and not necessarily well funded. But this is starting to change, especially in some parts of the world like Canada and North America, where their opioid overdose crisis has just really made governments see that they need to invest in this kind of service. I've kind of alluded to the problem, but I think it's worth just stating what the problem is that we're trying to help reduce the harms from here. It's essentially a problem that comes from these drug markets existing in a prohibition environment. And these are three different problems: adulteration or misrepresentation, where you buy one drug and you get another drug instead without your knowledge. Variation on purity, where you might get a higher than usual strength substance, and this then can potentially cause overdose if people don't know that they need to change their normal dose to compensate for that. And then the increased emergence of new or novel synthetic substances, and these can be misrepresented as better known drugs, and we'll see that when I move through, I guess, what's happened in Victoria and what's prompted the recent coronial recommendations. So ultimately, we're aiming to reduce injuries and deaths that could occur due to these issues in drug markets under prohibition through drug checking. So I've got this kind of schematic, and it's obviously necessarily simplified because it's schematic. But the idea is that you've got an individual they at some point they obtain a drug, they obviously intend to use it, they go to obtain it from the market, they then use it, they may have a bad experience or not. If they have a bad experience, that may end up with them seeking medical attention. Usually that goes well, hopefully, and then we go back to the start again where they might use drugs again. And so in this model, I've got sort of 5 different ways in which drug checking can, I guess, influence this process. And the first is, I guess, the one that most people focus on, this idea that after you obtain a drug, you want to get it checked. You might then choose to discard it when you get that information, but you can also do a number of other things, like you can change the dose that you use and make it less likely that you overdose. You can tailor your expectations of the effects. You might keep it in a different setting. So there's a lot more to it than just deciding not to take it or discarding it. Now, the second point would be you've consumed that drug, you've had a bad time, you've then gone and sought help in an emergency setting or an acute setting, and then the clinicians themselves could have better information about what it was that you took. And that might help them to manage your symptoms in a way that leads to better outcomes. So that's sort of the second place where it could be useful. The third place is in market shifts. So actually when someone is obtaining a drug, in that sense, they're interacting with their supplier, and in markets where there's a lot of drug checking, the consumers are more likely to know what drug and purity that is available on the market, and markets are less likely to offer misrepresentations over time because it's harder for them to actually sell that, and they're disincentivized to do so. The fourth one up here is seeking treatment. And so drug checking services, although they're not all about getting someone to go into AOD treatment, they can provide a referral service and do, for a small proportion of people, allow them to seek that kind of help. And we do know from research that most people that go to a drug checking service don't otherwise engage with AOD services. So this is an important point where we can see harms reduced. And finally, I guess across the whole situation here, finding out what drugs are on the market and especially what the discrepancies are between expected and actual composition. And this can inform a range of responses and provides a way of evaluating policies and interventions. So just a couple of days ago, Bruce Wallace and co from Vancouver Island Drug Checking Service put out this excellent article, and it looks even more broadly at the impacts of drug checking. So not just on informing composition and the individual, but just sort of these concentric circles moving out from the market to the community, and even as far as public policy, that having drug checking services in the community that serve a community and co-designed by them and with them can help to mitigate against some of the issues around prohibition itself and potentially mitigate harms from criminalisation. So I thought that was an excellent diagram to include there. So about 4 years ago, we conducted a catalogue of drug checking services around the world, which is now dated. And at that point, there were 31 drug checking services across 20 countries. I put a star on Canada. There was one service there back then, and I think there's maybe 5 or 6 now. There's some excellent work that's been done since in that part of the world. And the most longest running service is the Dutch, the Drug Information and Monitoring System. I can't actually read Dutch, but I found this particularly interesting 2014 when they had some red alerts, which are their sort of highest level of alert to the public. That final one in December, and it's the Superman pill here, where it was found to contain a lethal dose of a PMMA, which was unexpected in this pill, which was sold as ecstasy. So this was a quite important public service announcements that they were able to put out there. So I was privileged enough in 2017 to go and visit Fiona Measham in the UK and see the Loop in action. And these are some of the, there's obviously what they're doing at the festival and those interactions, brief interventions with punters there. But then there's also the public alerts they're able to put out with these amazing, incredibly high doses of MDMA that they've discovered in some of these tablets. And these are from 2019, I believe. These are just some pictures from Energy Control. It's also a very long running drug checking service, and they have an international mail-in service, which basically means that even people from Australia can find out, if they're willing to wait a few weeks, exactly what's in their substances. And yet there's a really large number of new services popping up. This one's just popped up in Vancouver a couple of years ago. So back 4 years ago, and we do need to update this, this is just looking at the kinds of analysis methods that we used amongst these services. And you can see there's still quite a lot of people using reagent tests, but most of the time they were using them in combination with more sophisticated technologies. And you can see a range of technologies here. But I just wanted to focus briefly on one of the more, I guess, new technologies that's been popping up in the last couple of years, again from Vancouver. I really liked this quote because Vandergrift and Gill basically put out the 8 different things that an ideal drug checking chemistry capability needs to have. And so this is sort of like the wish list. It needs to be sensitive, it needs to be quantitative, it needs to be specific, adaptable, free from carryover of contamination as you have a high throughput of samples, it needs to be fast, it needs to be field deployable, and it needs to be easy to use. So this is, you know, it's quite hard to get that all in one, but they appear to have done it. The problem is it does cost, this particular method. So they've developed this paper spray mass spec in a portable form, and it takes 1 minute or less to do this process, and it takes 1 milligram or less of the powder to provide a quantitative and comprehensive result, which is astounding. It really, I think, changes the game in terms of what a drug checking service can do and how quickly it can offer it to those people who are interested. This is just an example of what it can do. This data is actually from just a couple of months ago. You can go to the blog there that I've got down from the University of Victoria in California, and it shows you the vast range of quantification. You've got, you know, a minimum 0.3% here with fentanyl to a maximum of nearly a third percentage of fentanyl. Here you can see some of the fentanyl concentrations and how they vary. So that's the variability is really key. So just knowing that something does or does not have fentanyl may not really help someone on the ground working out what they're going to do with their drug use. But knowing that the concentration is really high and being able to titrate their dose is a really, you know, potentially life-saving in the context of the Canadian opioid epidemic. So in terms of Australia, I think most of you would know that we've had 2 Canberra trials at Pill Testing Australia conducted at Grooving the Moo, yet all jurisdictions except the ACT remain opposed. It's often framed in opposition to demand and supply reductions. So, you know, even though we don't have evidence that drug use increases in the context of drug checking, and we've had drug checking in many parts of the world to test this, we still get this sort of, oh, it's going to normalize drug use, somehow increase drug use. There's a moral objection to drug use versus just taking a pragmatic approach here. And the work I did a few years ago with some colleagues, which was a survey of festival and nightclub attendees and their acceptability of service design features in a drug checking service, you know, I think it was 94% of the sample said they wouldn't use the service unless they were guaranteed that police would not target them. So there needs to be that you can't just go ahead with a service like this without there being something out there in the public where the police say, look, we support that this, you know, we don't have to get involved, we're just going to stay neutral, whatever, something like that. And so this is a really complex area to find those partnerships. So this was also a really recent piece of research on Australian opinions of pill testing and drug checking. Representative sample, only 22% opposed it outright when asked about drug checking at music festivals. And younger people were more likely to support. Also, those who voted for the coalition or the Nationals were least likely to support. It was quite politically divided. But we haven't really tested public support for drug checking at fixed sites, so not at music festivals, for example, at a supervised injecting centre or similar outreach AOD centres. So that's something we're yet to explore. Okay, so I've got to part 2. I'm running 2 minutes behind, but I'll try and speed up slightly to get through. So I came to Victoria in 2003 from WA, and yeah, I was around in that mid-2000s for some of you that were also around then. Pill testing was certainly in the news a lot, and there was a proposal to do it at Earth Core at that year, but that was refused. And I found these old articles in my archives. And it's interesting, though, to look at them, because I found here the then Health Minister, Bronwyn Pike, who was saying that, you know, we do want to look at mechanisms whereby we can provide warning alerts to health and medical staff and to law enforcement agencies. You know, if doctors and others know exactly what's in these drugs, then they're more equipped to contribute to public information about how dangerous they are, etc. So there was sort of, I guess, back then, an acknowledgement of some of the issues that we've now been looking at, but still certainly a refusal to conduct what we were hoping to do back then. And in the meantime, from 2004 to, I guess, the middle of the last decade, one of the things that really changed was the growth of emerging and novel synthetic psychoactives. So this is just a figure from the World Drug Report, UNODC, and many of you would have seen this before. The notifications of new substances has gone up and up. There's been a bit of a dip in the last couple of years, but I guess this is the context within which this is all starting to develop. And so then we see this cluster of deaths in 2016 to 17 from the unintentional consumption of a combination of two unusual drugs, an N-bone drug and a 4FA, so amphetamine analog and a psychedelic. And these were seen in Victoria, ACT and Queensland. They were an unusual capsule, as you see the picture there. And so 5 deaths were sort of put into a cluster for the Victorian Coroner's report, which came out earlier this year, which I'll go through. But on one weekend, there were multiple deaths and hospitalisations on Chapel Street, leading to community action and warning. So you see here a photo from Rainbow Serpent Festival in January of that year. And this was in the Dance Wise tent, just sort of warning people about this unusual capsule. We also saw around that same time a leaked memo revealing that the police had seized a substance like this, very similar to this, that included 4FA and 25C N-bone. And it was at that time where there was some discussion about whether or not such information should be more publicly shared for public health purposes. So one of the things I helped to make happen was to get some of these drugs to energy control, because we really wanted to know what was in them. We didn't at that point know. And as you can see from, let's go back to it, you know, that when that was put up by Dance Wise, there's no information about what was in it. No one really knew. They just knew that there'd been deaths and hospitalisations, that we needed to stay away from something that looked like that. But we didn't know actually what it contained. So what we wanted to know was what it contained. And we found that when Energy Control received the substance, they worked within the day to get the information to us so we could publish it. And all of this information matched what Victoria Police had also found. So around this time, we were also seeing in North America a massive change in their opioid overdose rates of death, and this was in relation to high potency synthetic opioids, fentanyl, etc. And we were also seeing a little bit of that here. There were some signs in Melbourne, but you know, we weren't seeing the full. It certainly wasn't the same as what was going on in North America. And I think that got everyone a bit anxious. Is that going to happen here? Do we have the same conditions? Are we going to see this wave of fentanyl and this wave of death? So it was quite concerning, I guess. On the one hand, this combination of stimulants and psychedelics for certain population groups that thought they were using MDMA, and on the other hand, this sort of spectre of fentanyl for opioid using populations. So in the context of all of that, the inquiry into drug law reform was going on in 2017. As Sam mentioned, I've sort of was part of that as well. And that inquiry covered off on a large number of things, large number of recommendations. Drug checking was mentioned twice. It was mentioned in recommendation 47, which was related much more to this potential presence of fentanyl and carfentanil in the drugs market. So the recommendation was that the drug checking should be considered at a supervised injecting centre, which hadn't yet been launched in Richmond at the time. And then recommendation 49 was all about considering a trial of drug checking in Victoria, and that guidelines should be developed and an evaluation framework should also be developed. So unfortunately, we haven't seen that. This stalled, and it continued to be something that the Victorian government was not supportive of. And I think at that time, there was a sense of, well, what else can be done? we can continue to advocate, sure, but can there be other things we can do in the meantime that can help people to understand what's on these markets when things change, and to help, I guess, reduce harms in this way? So there were 3 different things that I'm aware of, and there's probably been more, but these are the 3 I've come up with. The second 2 were ones I was involved with, and the first one was a University of Melbourne-led consortium called the RAPID Project, and they have an excellent article that's just been put on a preprint server, so probably under review somewhere, if you're interested in that one. And basically, this was public drug alerts informed by chemical analysis of used bags and equipment. So this work is, and I'll show you some of the outcomes of this work in a moment. And the other 2 projects were, well, the second one was urine screening for fentanyl analogues to detect unintended use and therefore presence in the market. So this was work with Susie Nielsen, which then subsequently was better funded, and we've got some more work in progress there. And the third project, if you're in Rita and Isabel's breakout session before, was discussed there, the RapidDav project, to set up ways of rapidly sharing police forensic data more widely as drug alerts. So this project is still in progress, and I always expected it wouldn't be a simple project to try and make this happen, but it's sort of proving to be, I guess, just a bit of a long slog in terms of getting to the point where we can have an agreement to share this information effectively. But you'll notice all 3 of these are not something that directly engages with someone who uses drugs, which is what drug checking does, that they all miss that part of it. They're looking at, I guess, what happened afterwards, what happened after someone used the bag, what happened after they used heroin and what's in their urine. And in the case of the forensics, what happened after we seized the drugs and analysed them. So they don't have the same immediacy, and therefore they can't have the same rapid effect that drug checking can have. What they can do, though, is they can show us the need for drug checking, which I think is why it's really important that these sorts of things continue to be done. So then in 2020, we saw the then Department of Human Health Services, the Department of Health, releasing 2 drug alerts informed by the University of Melbourne information. N-ethylpentylone in cocaine, or N-ethylpentylone was detected in 2 different substances here. So this is what they look like, these kinds of advisories that were sent around by the department, which is excellent progress to see. And I just thought I'd put this in as a supplementary figure to the article by the University of Melbourne group, which shows the capability, the mobile chemistry capability that we have here in Melbourne to do this kind of work. I think it's important to see that we do have it, and we do have this capability. So moving forward to just a couple of months ago, the 5 deaths that were the centre of this investigation by the coroner of Victoria, these were Anson, Ilka, Jordan, Jason and James. And in all 5 cases, the information gathered indicated that they believed they were taking a different substance to what they were taking. And I certainly argued in my evidence to the coroner that if they had known what was in these substances, they would not have consumed them. It's really that simple. So following this inquest, the 2 recommendations that were made were that the Department of Health implement a drug checking service in Victoria as a matter of urgency, but that they also implement a drug early warning network as well. And those 2 things would work really well together. Without the first recommendation, the information that a drug early warning network would be using would be there, and as you saw in those earlier slides, we can gather information, but we tend to be gathering it not as rapidly as we could, and after the fact, after people have consumed, and with not as much information from the community about their experiences of what they're actually believed they were taking as well, and the form that it came in. So interestingly, the coroner, before they put out their report, actually invited key stakeholders to respond, and some of those are quoted within the inquest findings. And so the department provided this response, which was that it is considering opportunities to better monitor and respond to drugs and alcohol, including timely identification of harms, but that there is no current plan to trial pill testing at public events. So I think really it's a watch this space. The department is required to respond to the coroner by the end of this month. And the other thing I guess to note is the coroner of Victoria is now much more aware of this possible way of preventing these kinds of deaths. Whereas before, they may have been recorded as a death related to a novel synthetic substance. It might not have been considered whether that was the intent of the person to consume that or not. So now the coroner is aware of that, and I imagine will continue to recommend a drug checking service in the absence of action by our current government. So it is a watch this space in terms of what will now happen. So that's the end of that part. And now really briefly, I just wanted to introduce those of you that are not aware of the Loop Australia to it, and then hopefully we'll have a little bit of time left for any questions that you may have. So in my day job, I'm a research fellow at RMIT, but I'm also a volunteer research lead and a strategy lead for the Loop Australia. And this organisation has been established to work towards the development, establishment and delivery of drug checking services here in Australia. They can be performed in a variety of settings, as I've already mentioned. It's not just about festivals, community-based clinics, etc. And the service delivery model that the Loop uses involves a health intervention, chemical analysis, information dissemination, and ongoing research of all of these processes, because that's really critical to work out whether or not they're doing what they're supposed to be doing. Here's just a bit more information. We're a health promotion charity and mainly a volunteer organisation. Some faces there that may actually be watching right now, which is great. And we have local teams in Victoria, New South Wales and Queensland, and collaborate nationally and globally. And yeah, I mean, we've developed a lot of protocols. I think part of the with COVID, it meant that we were grounded. We couldn't, start talking to festival promoters or even talking to other people. It just sort of changed the landscape as it did for everyone. But what it also meant was that we could really establish these protocols and get all of our ducks in a row for the brief intervention, the chemical analysis, the research surveys, and the development of rapid alerts, which we've really developed up all these materials, so essentially ready to go. And as a result, there's lots of pictures of us doing online meetings, which has been excellent. And also very recently, we were actually at a festival, which was exciting in Queensland. And this is Jacob, who's our senior chemist at Earth Frequency Festival, showing our equipment. So yeah, if you weren't aware of the Loop, you are now, which is excellent. And you can always have a look at the website to find out more. It's been really excellent working with this kind of organisation, so that, for me doing research day in, day out, that I'm also, engaging on the ground with something, with a service delivery organisation. Okay, so that's pretty much it. I do want to thank everyone, and yeah, I'm happy to take questions if there's any time. Thanks, and I'll stop sharing.
Thank you so much, Monica. Thanks for taking us down the magical mystery path to drug checking in Victoria. Look, while some questions might get raised, either put them in the chat, so I'm keeping an eye on it. Please feel free to do so. But I think that the mystery for me is we have so many sources of information which should be brought together to save people's lives, and yet there's great resistance at doing the logical thing, and we prefer to see it on headlines in newspapers and in the coroner's court. Now, the police sit on really valuable real-time data, well, close to real-time data on what they gather. The consumers and the community has a whole range of experience it could be feeding in. So long we get the mechanism for delivery of information right, and there's many examples around the world, and we've got a system to systematise it, and there'll be great benefits to all parties involved. There's a question there about how much of the drug is required for testing.
Yeah, I've noticed that question. Thanks for asking it. And it does depend on the analysis. So there are some analytic techniques that require no drug because you can just scan the package. But I mean, that paper spray mass spec that I showed you from Canada, they need less than 1 milligram to quantify and comprehensively analyze. So that's pretty amazing. But then the work that Professor Gavin Reid and everyone from University of Melbourne is doing, they require literally traces. So a licked bag that has no visible traces can be assessed for drugs. So they can't really quantify as easily because of that, but they could provide, well, here are all the traces of all the drugs that were here. So yeah, it does depend on the technique. But I think what's really excellent is there are some techniques now that use very small amounts, which I think is helpful to make that work for the consumers that are using the service.
Thank you, Monica. Has anyone else got any questions?
I can definitely share the slides. I just saw that one. Happy to share the slides with Julia. I also just wanted to note, yesterday I went to Penny Hill's amazing presentation, and she's working at NCRED now on the prompt response network. And that's very much related to the work I'm doing here, but it's more of an attempt to make a national network that can, I guess, bring together these pieces of information and help states to talk to each other as well, because drug markets don't respect state borders, as we can see.
Yes, well, that's one of the silos, as Rita suggested, we should bring together, because there's a lot to learn from other states as well. And if we can get a national network, all the better. The entire session's been recorded and will be posted on VAADA's YouTube page. And the resources and slides will be shared on that side as well, I believe. Thank you, Monica. I really appreciate it. Should any other questions be located in the chat, we'll forward them on to you. I'm going to hand you over to Julia, who's going to talk about a winter webinar that we've been organising, which once again has sort of got king hit by the COVID changed arrangements. So over to you, Julia. Thanks, Monica.
Thank you, Sam. So as some of you may have noticed, you follow us on e-news and such. We have announced pretty short notice an AOD winter webinar that's kind of fallen out as an opportunity from some reschedulings of other forums and network meetings we had. I'll post a link to register for that in the chat. If any of you wanted to join us next Thursday from 12 to 2 p.m., we'll actually have a two-part webinar. And the first part will be with Professor Ed Ogden on ADHD in childhood, drug use in adolescence, and drug-induced psychosis. Pardon me. And part two, which kind of follows in from a bit of what Monica's mentioned, is on novel psychoactive substances. And we'll have Cameron Francis from the Loop Australia there, talking about novel psychoactive substances and a bit of what they've learned from their work at the Loop. So if you want to register for that webinar, it is in the chat. And beyond there, the other thing I'll note, Sam, before I hand back over to you, is that when you leave this webinar, there will be a survey that comes up. We'd very much appreciate if you guys do that survey as well. That's everything from me. Thank you.
Thanks, Julia, and thanks, Scott, and thanks the team at VAADA, who have put a lot of effort into changing from one format to another format multiple times across different endeavours we've undertaken, and warm thanks to all the participants today, many of whom have stayed online to the end. There's a lot that's come out of it across the workshops, and including the mental health presentations, the department's forward-thinking presentation, I think gives us a lot to get our teeth into. The panel conversation raised a number of issues. Many of these things will take their own trajectory going forward, and we will be seeking to run other events and activities to try and drill into it and give the sector some scope to get their teeth into the intricacies of it all. So that's it from me. Thank you so much, and we'll see you all next time.